Dr. John Campbell. Now, I've known about this since 2018, fen-ben and stage 4 cancers. In Canada, what are we doing? Oh, we're maiding them, giving them maid. Why not just give them the dog medicine? And I've tried it, I had to because it's so filthy downtown east side in the indigenous neighborhood in Canada because the Canadians keep it absolutely loaded with drugs, urine, fumes, poop, and filth and diseases. So maybe instead of taking out the cancer patients, Canada, you can give them some fen-ben. Okay? You don't have to take them out. And I tried it because I know that we have so many germs here. I probably had parasites in my tummy, and it took the hospital 3.5 years to figure out why my pain was worse than natural childbirth, living down here, and I was vomiting like crazy. Well, it turned out that my stomach flap doesn't work, and I get food poisoning from the stinks down here, which means I qualify for the MAID. Plus, I got PTS, more MAID. I qualify medical assistance in dying. I call it medical murder. So anyway, I have tried it. I did feel better for a while, but when the Canadians loaded tents in front of our over 55 building with all 100% druggies pooping and peeing in front of our building, the smells were so horrible. So I actually had to get medicine. 3.5 years to get diagnosed because science is retarded. Yeah, you are retarded, science. I thought we figured out you don't turn neighborhoods into outdoor toilets a long time ago. A very long time ago.
Welcome to this talk. Now, are we missing out on cures for cancer is an interesting question. And today we're going to be looking at this paper here. Fenbendazole as an anti-cancer agent, a case series of self-administration in 3 patients. And we'll be addressing the small number of patients later on in this video. And as always, I've got all of the notes here and the links that we're going to be using. So the thing is, fenbendazole, it's actually a veterinary preparation in the UK.
Our enslavers at the top know about it, and that is why they have not want us to buy it anymore. Like in America, you can buy this in a pet store. Not anymore in Canada. They're taking that off. You need a prescription for your animal. Like those damn Canadian politicians, they're not dumb. They know what they're doing. They know exactly what they're doing. It's the population depopulating us.
Humans, but it's very similar to mebendazole. But this is about fenbendazole. Now, of course, this is not medical advice in any way, shape or form. Never stop or start any treatment based on what we say in these videos. This is entirely for educational interest purposes only.
Absolutely, I agree.
So, fenbendazole is an inexpensive, widely used, accessible antiparasitic drug used in veterinary medicine, dog dewormer, if you like. And
That's
it's
why I took it, dewormer.
It's readily available, and
we got parasites in our neighborhood, and I was so desperate to get rid of these tummy aches that were worse than natural childbirth, and went on for 3.5 years, on and off. So it was absolutely horrific, just absolutely horrific experience with the medical people. Especially Satanic Paul's Hospital. Had a horrific experience in there. I was wondering, how many times do I have to tell you guys I live in an outdoor fucking toilet that you racist Canadians make for the indigenous people to live in? What kind of fucking education were you giving them at MK Ultra Trauma Residential School, okay? Because what kind of education are you giving our our kids today that they don't even know that poop and pee don't belong on our streets. What kind of education are you giving people when they believe in safe supply lies? And then the people that believe in the safe supply lies vote, that, oh yes, less medical assistance in dying, the druggies too. So they're probably going to have something happen to them, They are. They're not going to be welcomed into the new one world order, And that's not me saying that. That's Noah Harari from the WEF. They're all being set up. I'm all set up, for the KILL program.
In the early 1990s. Now, I think you know what this means. It means that anyone can make it, therefore it's hard for any manufacturer to make a lot of money out of it. So it's now a generic drug, so people can make it. Indian pharmaceutical companies can make it by the ton if they want to, and of good quality as well. So let's look at case one in detail, and then I'll just mention the other couple of cases, more not quite in passing, but with a little less detail, otherwise we'll be here forever. And if things go well, I'm going to give a fascinating story from the history of medicine as well, but you have to hang on for that. So case one, 83-year-old woman, October 2021, stage 4 breast cancer, and I've listed all this here. I'll put this all in the notes so you can follow the story for yourself in the description. So stage 4 breast cancer, in other words, it spread around the body, metastatic disease. She'd initially been diagnosed with breast cancer in 2009, but she'd been treated. She'd had a bilateral mastectomy in 2009 and other treatments, and she did well for a while, but then the disease recurred in 2021. A liver biopsy confirmed metastatic breast malignancy. In other words, it spread to a liver. Now, we say if it spread to your liver.
I met a woman with the breast cancer, and it had done that, what he just said, and, she didn't really have big breasts either. I was shocked. Just a little skinny thing. And I asked if I could feel it, not because I'm a perv. It felt hard like a rock, hard like a rock. I just couldn't believe it. It was shocking.
So this had spread to a liver, confirmed metastases, acidic fluid. So ascites is the swelling in the abdomen you get as a result of cancer and other things. But that confirmed metastatic breast cancer when you take the fluid from the abdomen through a tap in the wall of the abdomen, you send it for cytology and they could see malignant cells. Now, magnetic resonance imaging, MRI, of the spine, October 21, metastatic breast cancer in T12, that's thoracic 12, thoracic 10 vertebrae, lumbar 1, lumbar 2, lumbar 3, number 4, number 5, sacral 1, sacral 2, and the iliac bones. In other words, this had spread to her liver and her bones. Clearly an intractable terminal diagnosis by all criteria. It was all over the place, basically. A PET scan. Now, a PET scan indicates metabolic activity, given a radioactive isotope, and it detects metabolic activity. And of course, cancer is very metabolically active, so that would light up. So a PET scan on the 29th of December 2021 showed 6 hypermetabolic lung lesions, and the largest was 2.8 by 1.5 centimeters. In other words, it was in her lungs. So it was in her spine, in her lungs, in her liver. This was everywhere. Hypermetabolic bone lesions, biggest was 5 by 2.9 centimeters. And a lytic lesion, that just means basically you see a hole in L4 extended to the spinal canal area. Patient declined further conventional chemotherapy or radiation therapy and was placed under hospice care. So basically, end of life care. Now,
there was another dude that was told to go to the hospice, but did the Fenben in stage 4, and he's still alive to this day, and he still takes the stuff, and he orders it from America because he lives in America, and he orders so much of it they actually throw in free dog bones. Can you believe that? So sweet.
Accurately, but I've got it all here. November 22nd, 2021, she started self-administering fenbendazole at a daily dose of 222 milligrams. So she just basically started giving herself fenben. In December 2021, she received another injection to block estrogen, intended to inhibit cancer growth. So you got a bit of a complication there. You got two treatments going on at once, but to give an estrogen blocker at this stage would not, under normal circumstances, be curative. Anyway, moving on to 2022 in January, she did have targeted radiation for 2 spinal metastases. The spinal metastases are horrible. Things press on the spinal cord and on the main nerves. The pain can be indescribably bad. Nerve pain is you really don't want nerve pain. So she had radiotherapy for that, but that would only affect where the radiation targeted. It wouldn't affect the liver, it wouldn't affect the lungs, it wouldn't affect the other vertebrae. These tumours disappeared rapidly, relieving the pain within a few days. So very effective palliative treatment, but not curative because it wouldn't affect the cancer in other parts of the body. Continued taking 222 milligrams of fenbendazole a day for 8 months. During this time, her liver enzymes normalised. So the cancer wasn't a liver, that would alter her liver enzymes, but they went back down to, liver enzymes went back to normal. Now, something called CA2729 is a tumour marker. That dropped from 316 in November 2021, and then in July 2022, so 7 months later, it was down to 36.6, indicating there was massively less tumour in her body. Then April 2022, a PET scan, again looking at the metabolic activity, confirmed the absence of any abnormal metabolic activity indicative of cancer. Quite staggering. So it wasn't her lungs, it wasn't her vertebrae, it wasn't her pelvis, it was in her liver, and yet after 8 months of fenbendazole, the PET scan confirmed the absence of any abnormal metabolic activity
So you can watch the rest of this on Fenben in stage 4 cancer, Dr. John Campbell. Now, at first, I didn't really like Dr. Campbell. He was promoting the Jabberoo, and I thought he didn't do his research. I accidentally stumbled into that Jabberoo in 2018, 2019, and was protesting it in 2019 because it wasn't very healthy for all the little puppies that they were trying on it. So I was standing up for the dogs. And no idea that the flu was on the way until, got a shock from Bill Gates with his little program that he had showing a flu coming and what was going to happen. Then I had a panic attack, and then it happened. So I must have had my panic attack was like a premonition. Oh my God, they're going to make it happen. Event, what was it called? Event 100? I can't remember what it was called. But yeah, it was a little video. So it was predictive programming. Anyway, another dude, totally healed, still alive to this day. Isn't it better just to give this people that Canada's taking out with, the MAID program, this stuff, and see if they can't cure themselves? No, it's not. In fact, I know, our leaders know that you can use this stuff, and they're prohibiting it, just like ivermectin. And ivermectin, they made it a bad drug. Oh my God, you can take fentanyl, but do not take ivermectin. Oh, we're worried about the druggies not having enough fentanyl during the lockdowns, but don't take any ivermectin. That's bad. And then when the masses lost their cognitive abilities, they couldn't answer the question like, what's bad about it, or even ask, because they would have found out that it won a Nobel Peace Award and it was 100% safe. Never took anyone out. Another thing the Canadians didn't do. You know, so when they say COVID killed my loved one, I go, was your loved one in the hospital? Well, did you check the medication they were giving? Because I did. I checked the medication, and if I had gotten COVID, you know, which I didn't because I didn't take the jabberoozy boozy, I wouldn't have took the medication because I was aware of what it was. It was failed medication. But, no. Anyway, I guess I should be grateful that I didn't get cognitive dissonance.